Thank you, Madam Chair. Thank you, members of the committee. I am presenting this bill, obviously, under circumstances that I wish I was not having to be here to present this bill. So I really do hope that Representative Bazemore, my colleague and friend, is feeling better. I'm presenting House Bill 358, LC 339189. This is a bill that simply does two things. Number one, it adds HIV prevention instruction to the sex education code. And number two, it adds best practices for and risks associated with tampon use, specifically the development of toxic shock syndrome. So really quickly, this just clarifies that HIV prevention shall be taught in sex education. Currently, we only require AIDS prevention. However, it's important to note that HIV and AIDS are not the same thing. And in fact, with advances in medicine, many people living with HIV live long, thriving lives and do not progress to AIDS. Still, it has been a goal of at both the national level as well as the state level to eradicate HIV. And this is actually really important here in Georgia because Georgia leads the nation in new HIV cases. And so that's very important. I do believe an ounce of prevention is worth a pound of cure, and education is one way to prevent. This bill also is related to educating students or patients on the risks of tampon usage. Specifically, it requires notifying students of the risks of toxic shock syndrome, which is a bacterial infection associated with tampon usage. I do want to be clear, this is rare, but in cases where it does happen, it can be fatal. And so that's why this is important. And it also encourages any healthcare professionals who provide tampons to their patients to provide information about these risks. And like I said, risks being that while this is something rare, and through advancements in just knowledge in the field of microbiology, we've been able to pretty much eliminate this. It is not gone, and in some states they're actually seeing a resurgence. And so it's important that we provide that information so people know and can make good, informed decisions. And with that,
All right. I have a question. This has come up on the floor of the House the other day. You're saying that we already have in the curriculum to teach about AIDS. Now, I know the difference between HIV and AIDS. What is and I know you're doing this for Deborah, but what is the difference in what the curriculum would be? What you would teach about AIDS prevention and HIV prevention?
so that's actually a very good question, and actually that part of that language is actually in a bill that I've proposed many years as well. So I'm glad you asked that question.
Me too.
When it comes to AIDS, AIDS is in stage. It is advanced. Acquired immunodeficiency disease. Basically, your immune cells have been depleted and you can't fight off normal infections the way most people can fight off a normal infection. A lot of times in some of the curriculum here in Georgia that is used, the way they teach AIDS prevention is by saying if you don't have sex, you won't get AIDS, you won't die. However, that skips a whole section of HIV, which is there are a lot of ways that we can prevent HIV, and also just teaching about things like PrEP and all of the other interventions to decrease the likelihood of people getting HIV. So it is very, very, very possible. It is very possible to teach about AIDS and skip HIV, and skipping HIV it's really important because we can't eradicate it if we're not even talking about it.
Okay. So you're basically saying the way that the schools, if it's in our curriculum now, it's basically just saying the same thing as abstinence, I can't say it, never have been able to, that just not having sex is how they teach, that's how you take care of AIDS.
In some of the curriculum that is used across the state, that is pretty much how it is presented, is basically not being hyperbolic. This is how it is presented in some places. Having sex, if you have sex before you get married, then you will die from AIDS. And that's pretty much all that you have to say according to this curriculum. And that's how it is presented in some places. And that's unfortunate. This will at least require a level of biology to go into that instruction so people really truly understand the risks.
Okay, I can't wait to hear what's going to come from Representative Perkle next.
Okay, so there was a challenge that the boys would remain silent on this one.
No, I would love to hear from you.
I just told you
But,
to get ready for this.
From the lady who loves a question at any opportunity, I must
love it. I
absolutely
know. This is-
provide
feels
a
good.
question now. Finally, tables are turned. So help me understand with two questions, if I can. So the first one regarding the HIV/AIDS deal. Am I right in assuming in a Venn diagram of HIV at Georgia Tech?
Look, did you learn Venn diagrams for the vice president of the country?
So, well,
She loves them. Do you love them too?
I didn't know how. I
didn't
don't
know.
listen to her much. I have no idea what she's got with that. But we did learn that at Georgia Tech. So if you looked at a Venn diagram with the outer of HIV, am I not correct in assuming the Venn diagram of AIDS would be wholly encircled within the Venn diagram for HIV?
So, yes, if you want to simplify it. However, as I said in my presentation, every person that gets HIV does not get AIDS. In fact, with medical advancements, lots of people go on to live very, very, very long lives
This is
without
true.
ever advancing to AIDS. And so that's really important because teaching sex education as a doom and gloom situation instead of being biologically and medically accurate and teaching it in a way that says you want to prevent getting HIV, not just because you want to prevent getting AIDS, but because we want to, as a state, not lead the nation in HIV cases. But we can't do that if we're not even talking about it in the classroom. So, number one, when we use the word AIDS, that's really outdated language. Most public health systems, public health departments would say that it's much more accurate to talk about HIV. And again, we eradicate HIV. So to your point, if we can eradicate HIV, we can eradicate AIDS. But I think as a state, we should be pushing for decreasing the number of HIV cases. So we have to talk about it. And that's what this would do. So we're already talking about AIDS, but let's add the HIV component in there so that we're giving students the
See, I don't see
information
how you talk about AIDS, if I may, Madam Chair. I don't mean to talk around you. But yes, ma'am.
Family discussion?
So,
Go ahead.
I don't know how you talk about AIDS without talking about HIV.
I would agree with you unless I didn't know for a fact that is done in classrooms right now. They
So
completely
my mom
skip.
retired as a health educator, and I sent all three of my kids. They had the unfortunate experience of having their granny give them the talk, if you know what I mean. So I do know a little bit about this, and so I'm just a farmer, but I do know about this. Regarding the tampons, the Section 2 part of the bill, so this is in a hospital, if a physician or a nurse in the hospital provides a tampon to a female patient, then they must provide written stuff.
Yeah, like a pamphlet. So a lot of times, if you've ever bought a box of tampons, maybe for someone in your family, you'll know that inside of that box there's a pretty extensive pamphlet that tells you how to use the tampon, but it also talks about the risk of toxic shock syndrome. This would be the same. So if you're in a hospital setting, you might not be getting a huge box of Tampax that has the pamphlet in it. This would just say, still provide that information to the patient if you're just handing like a single-use tampon without the insert.
So just for the record, while I have bought those products, I've never opened them up to see the pamphlet.
Representative Houston smiling again. It's good to see. Representative Hutchinson.
Thank you, Madam Chair. I want to let Representative Houston laugh some more. I went to Catholic school, and the nuns told us that if we kissed a boy, we were going to hell because it promoted impure thoughts in the boy. So I appreciate any specific scientific education that we can give students in Georgia. And on the toxic shock syndrome, I had a mental health patient that was in children's health care for a week. She was 16 with toxic shock, and it wasn't that long ago. So I do know that it is still a thing, and it's still something that we need to make sure girls understand.
Gonna get
We're
better.
talking about tampons. Where are you going?
I understand. Okay. I mean, we're laughing, but we know that, we don't mean to. Sometimes you just have to laugh a little bit to ease the tension. So anyway.
But I just wanted to say that.
Okay, Representative Al. Lighten up.
You keep telling me to lighten up. I'm very lighthearted in this place. I think basically what this bill aims to do is something you explained very well, which is to modernize our approach to teaching the specifics of and the prevention of HIV, right? And I think that the point you're making, and isn't it true, that the point you're making is that we cannot teach it as a binary as we have back in like the 80s and 90s. Like when I was growing up in New York, we were taught that it was a yes or no, but this newer approach to HIV treatment and care is that we are treating it like a chronic disease. And there are many aspects to it and many qualities to how we approach this that deal with prevention that people need to know, right? Especially in a state that has the highest new percentage of HIV cases in the country, that talking about PrEP, talking about perinatal prevention, talking about antiretroviral therapy, these are all parts of the discussion that we need to have, and it isn't just a binary of you're HIV positive, you're not, because that leaves out 95% of the information that people actually need.
Right. The point is there is a big bridge between abstinence and AIDS, and we need to fill that gap. And that's what the first part of that language does. And secondly, when it comes to information, I don't think we should ever scoff at providing information, especially information that might save someone's life, on the part about toxic shock syndrome.
Okay, Representative Anelowitz.
Thank you. Yes, so this is related to the tampons and the toxic shock syndrome aspect of this bill. Several years ago, and this happened after there were several natural disasters, after Hurricane Michael and other tornado issues down in South Georgia. And one of the things that the food banks that were working down there realized was that in addition to a need for food, water, essential supplies, there was a need for menstrual supplies for the women and girls who had lost everything. And one of the problems that the food banks, and I'm just checking my notes, which is why I'm looking at my phone, one of the problems that the food banks found is that they weren't able to distribute, like they couldn't, if you had it, they had to distribute entire boxes of tampons, not just a supply of like maybe 15 or 20 tampons if it's a box of 40. And they had a lot of problems distributing those menstrual supplies because they were told they couldn't separate the tampons from the instruction pamphlet. This was a crisis situation. It was, these women didn't necessarily need an entire box. And frankly, to give everyone an entire box was going to limit how many menstrual supplies they were able to distribute. So these food banks were able to get permission to distribute these tampons without this kind of information. Would this legislation preclude that from happening?
So the way it is written, it does say healthcare professionals, so specifically doctors and nurses. So in that situation, I'm not so sure that it wouldn't, they wouldn't be able to do that. Apparently, in their opinion, they already couldn't do it. And so that's an interesting
But now they can,
point.
right? They have permission to do
Yeah.
that now. And would this preclude anyone who wasn't a nurse, like a school nurse or a nurse, from giving people menstrual supplies?
This encourages. So it doesn't require, it is an encouragement to provide the information. So it does not say that you shall require or you shall give the right information. It is they're encouraged.
Because that was
to
there were a lot of obstacles to making it so that
Right.
the food banks could distribute these menstrual products.
No,
and I
that's
wouldn't want
very
anything
important.
to happen that would prevent that from happening.
Agree, and that's very important. So it's more of an encouragement. It's not a requirement.
Thank you.
We got two more, Representative Reese, and then we're going to let Representative Taylor end it.
Thank you. I was hoping to have a little fun with Chairman Perker before he left, but
Aw.
I also wanted to, if I can get like someone to share like what exactly is toxic shock syndrome. I know we got some doctors here. If one of you guys volunteer to come up and tell us from
I
a
can
medical
tell you
perspective.
as well as a
But,
microbiologist.
okay, but that's right.
I
Doctor
mean,
right
we-
here too.
We have our own doctor here, but would y'all like to do a little impromptu? No? We have one female. Remember it from before you started dermatology?
So as a microbiologist, I can briefly tell you that it is a bacterial infection. Usually it's caused by either streptococcus, or so think strep throat, or staphylococcus, so think like staph infection. And these bacteria release a toxin. And so when it releases that toxin, this actually causes the body to go into shock. And when you go into shock, your blood pressure drops so low that your heart cannot adequately pump blood to get it through the circulation. So it can be deadly if not treated very, very quickly. And so it's really.
Well, what time frame are we talking about with this transpiring? Like, is this like after a few days or a week or a month or?
Usually, if you start having symptoms of shock, you are at a point now where you need to be in intensive care. So this can happen pretty quickly. So the onset of symptoms can be pretty quick. You get a fever, there's a rash that kind of looks like a sunburn, and there's some other things. The shock can also lead to organ damage. A lot of it's associated with kidney damage and things like that. So it's serious, and it really does start with these little tiny microbes like strep or staph that get or release toxins that cause our body just to react in a very strange way very quickly.
And so that can happen with misusage
Yes.
or overusage.
Wearing a tampon too long is usually what's associated with menstrual associated toxic shock syndrome.
Okay. Representative Taylor, to end this discussion.
We will. Thank you, Madam Chair. Actually, this is a very, it's nice to talk about issues, but this is a very important issue. And at the appropriate time, I'd like to make a motion to move.
Well, unfortunately, it's too late to.
Oh.
Well, it's really not too late to move on it. Okay, we've got a second. Does it? But in this now, wait a minute. Let me get it clear. I don't remember from reading it. Does it require that the doctors?
No,
No,
it is
it's
an
okay.
encouragement.
Right.
Okay. All right. I'm going to let this committee do what they would like to do. At this time, we have a motion of due pass and a second. Further discussion by the committee. Okay. Anybody in the audience left that would like to still say anything? We got anybody from the department? Okay. Then we've got the up on it like this. Okay. So hearing none, everyone in the favor of the passage of House Bill 358, say aye.
Aye.
Anyone opposed? No. I think the ayes have it. Will you please let Representative Bazemore know that as soon as
shall.
you can get that? And thank you for our step. I'm sure that you tell her that I tell her that this is our bouquet of flowers to her. Okay, thank you.